Welcome to Addiction Group's podcast, where we address pressing questions about addiction. Our goal is to provide insight and guidance for those seeking answers. I'm your host, Anna. Welcome back to Addiction Group's podcast. Today, we're diving into the challenging and complex world of detox and withdrawal. To help us navigate these waters, we have Ben, a specialist in addiction and recovery. Ben, glad to have you with us.
Thanks for having me, Anna. I'm ready to shed some light on these important topics.
Ben, let's start with the basics. Could you explain what detoxing entails and why it can be so tough for individuals?
Sure. Detoxing is essentially ridding the body of addictive substances and sorting out the withdrawal symptoms that come after. It's tough because withdrawal often involves both physical and psychological discomfort, which can range from mild annoyances to severe life-threatening symptoms.
How long does detox typically take, and what factors influence that time frame?
The length of detox varies widely. It can be a matter of days or stretch out to several months. The timing depends on several factors, like the substance used, the frequency and quantity of use, any co-occurring mental health conditions, and personal factors like medical history, age, and gender.
What can someone expect during alcohol withdrawal, and how do you recognize the severe cases?
With alcohol, withdrawal symptoms can start as soon as 6 hours after the last drink. They range from minor symptoms like anxiety and headaches to more severe ones, including hallucinations and seizures. Delirium tremens, or DTs, is one of the most serious conditions marked by high heart rate and possible seizures.
And what about drug detox? How do those timelines compare?
Opioid withdrawal might kick in within 8 to 12 hours, with symptoms peaking in a few days. For benzodiazepines, it can vary depending on the specific drug, with symptoms appearing anywhere from 24 hours to several months after the last use. Stimulant withdrawal is known to show within hours to days, and symptoms peak about a week in. Of course, this varies significantly with drug type and individual circumstances.
That sounds intense. What kind of withdrawal symptoms can occur for the more common drugs?
Opioid withdrawal can come with a range of symptoms, from runny nose and sweating to muscle cramps and anxiety. With stimulants like cocaine or meth, people often experience depression, anxiety, and a physical slowing down.
Let's talk a little about what a typical detox program might look like.
Typically, detox programs are about 3 to 7 days, followed by several weeks of intensive therapy. They can be inpatient, where you stay at a facility, or outpatient, where you live at home and regularly visit a healthcare professional. The programs start with a thorough assessment to tailor the detox plan, and medication is often provided to manage the withdrawal symptoms.
That's quite the process. Now, after someone completes detox, what's next?
Post-detox, most individuals transition to an alcohol or drug rehab program. They receive intensive therapy designed to address the root issues and pave the road to recovery. Support groups are a crucial element in avoiding relapse and maintaining sobriety long-term.
And for those in recovery, could you share some tips for staying sober?
Absolutely. It's all about building a supportive environment and making healthy changes. Identifying triggers, recognizing relapse signs, establishing a structured schedule, practicing healthy living, seeking support. These are all vital steps. Always remember to celebrate your milestones, no matter how small they may seem.
Ben, this has been incredibly insightful. Your expertise is invaluable to anyone facing addiction.
It's been my pleasure, Anna. Remember, recovery is a journey, and there's help every step of the way.
Thank you for sharing your knowledge with us today, Ben. And to our listeners, thanks for tuning in. Remember, the road to recovery is never walked alone. Until next time, take care. Thank you for tuning into Addiction Group's podcast. We hope our discussions bring clarity to your queries about addiction. Remember, we're here to support and guide you. Until next time, stay informed and stay strong.